Hello everyone. I'm Rachel from the Bloomfield Public Library, and we're here tonight with Matthew Morgan, the Executive Director of Journey Home. We're so glad, Matt, that you could be here to talk about what your organization does to help the unhoused right locally near us. We're in Bloomfield, Connecticut, obviously, and so I know you do a lot of work in Hartford. And what we're hoping tonight is that we can hear some things that your organization is doing to help this issue, and also maybe how we can get involved. With that, I will turn it over to you.
Well, thank you, Rachel. And good evening, everybody. I am so impressed to see so many people who care about this issue and who want to hear more, learn more, and contribute more to this important topic. My name is Matt Morgan. I am the Executive Director of Journey Home, and I have been serving at Journey Home for 14 years as the Executive Director. Worked previous to that also in homeless services in Rhode Island for a little while. I've done community organizing in New Haven. I've worked in affordable housing stuff in California. I actually am someone who has experienced homelessness when I was a child. My family's home burned, and so this is an issue that is really important and an issue that I'm really passionate about from a personal basis as well. So I'm gonna go through a deck of slides that I've got prepared, and I'll just, if there are questions as they come up, if you could just drop them in the chat, and I'm gonna ask Rachel if you can help monitor that for me, so because I won't be able to do it all probably at once, and look forward to hearing from many of you as we go through this. And if there's any really important things that you want to make sure that I try to cover as much to the extent that I can, feel free to go ahead and drop those in the chat now, so that I can be preparing my thoughts for how to respond to those. Would greatly appreciate that. All right, so I'm going to go ahead and share my screen. Let's see. All right. So why is there homelessness? Why does it exist? I'm sure many of you are experts on this already. I would say that one of the causes, it was really back in the 1970s when deinstitutionalization happened. In the past, people with mental illness were locked up. Um, and um, and fortunately, that changed. And in the 70s, when deinstitutionalization happened, and we almost we did away with almost all of the kind of institutional settings in Connecticut, and many across the country. But what didn't happen when that occurred was ensuring that there was ongoing housing solutions for people that did have mental illness of any kind. And so, this comic strip here shows, in the 2000s or now 2010s or 2020s, we still have people who are unsheltered, and a great number of people, of 67%, report having some kind of a mental health or substance use issue. The other number one reason I would say that people do experience homelessness, regardless of whether they have any mental health condition, is the affordability problem. So the math is, does your household budget have sufficient income to pay for and afford housing? We've seen research come out over the last couple of years that has really clearly documented that there is the number one correlating factor to homelessness is that gap between rental prices in a community and incomes in that same community. So a place like California, for example, has massive amounts of homelessness. Their housing market, rental market is astronomical. They actually have about 25% or more of the homelessness in the country is actually in California itself. And you see this correlation across other, expensive rental housing markets across the country. So that's the number one thing I always say is like if you don't have enough income, then we need to figure out how to get more income. Or if you're not going to be able to get income, then we have to figure out how to provide rental assistance to make the housing affordable. Um, and just a little fact here. The only 11% of people experiencing homelessness report having earned income, and almost all of these are underemployed, so they're not earning enough to be able to afford an apartment. Um, and then only 30% of people who report a disabling condition have supplemental security income or social security disability income. And as you know, many of you may know that the even having SSI or SSDI alone can sometimes not be sufficient for people to afford an apartment in the community where they want to live. So here's just some basic data on homelessness right here locally. So this is for the greater Hartford region. So the city of Hartford and about the 30 municipalities surrounding it, or 29 municipalities surrounding it. 35,000 people calling 211 in a year, who are reporting having some kind of a housing crisis or seeking, shelter assistance of some kind. Another close to 1,000 people are walking into our what we call hub sites. So for people that don't have phones and can't call 211, they are referred to these hub sites in the community. And we've seen about 1,000 more people, flowing into those. We have a wait list for emergency shelter right now, unfortunately, and there's almost 400 people on that list. And then there are around 200 people who are currently unsheltered that we know of in Greater Hartford right now and living in encampments and under bridges and the parks. Um, and then lastly, there are 397 emergency shelter beds in the region. 90% of those beds are in the city of Hartford. The others are in Manchester, Vernon, sorry, not Manchester, Vernon, and East Hartford. And then as far as seasonal beds, there's 186 additional beds that open up in the winter time in the region. And actually, about 50% of those are outside of Hartford, 50% are inside Hartford. So there are additional sites in Manchester and Enfield, um, and um, and East Hartford that have open, and as well as Hartford that have open additional warming center capacity to be able to serve more people in the winter to help people from freezing to death. Now, as you see the second column here, 899 people is how many people entered the shelter in 1 year. So in those 397 beds, basically they were served with each bed was served by two people. So you could you could estimate around a 6 month length of time people are staying in the shelters, um, uh, or a little more. And then in the cold weather beds, those seasonal beds, 990 people went into those beds. So you can see the difference. There's a lot more uh, movement in those cold weather beds. Now, in the regular season, year-round emergency shelter beds, those once you're in, you kind of have your bed reserved until you are housed, until we can have a positive exit, ideally, or until the person leaves of their own free will. The cold weather beds, those are not reserved for you. It's just first come, first serve every night. Whoever shows up, everyone's directed to these cold weather warming center sites. And whoever gets there first is able to get the beds for the most part. Um, let's see. Um, so the gap here. So now Journey Home serves as this coordinating entity. So all of the housing programs that prioritize people who are experiencing homelessness, those openings are all reported to Journey Home. And so we track this on an annual basis across all of the supportive housing and rapid rehousing programs. Supportive housing means permanent, subsidized, housing that has rental assistance and permanent case management services with it. Across all of those programs, as well as the rapid rehousing programs, which is temporary rental assistance and services, only 331 openings happened in 1 year. So you can see the difference. Oops. We had 900 people come into emergency shelter in a year, plus another 990 that came into the warming centers, almost 2,000 people, trying to fit into 331 openings in all of the rental assistance programs. Our system is clogged as a result of this. We do not have the resources needed to make sure that there's flow through this emergency system so that when people do have a housing crisis and they have an emergency, that there's somewhere for them to actually go and some help for them to get out of their homeless crisis. So we're estimating 986 more slots of subsidized housing of rental assistance and services are really needed to help. Not everyone that enters shelter actually needs rental assistance and services, but we need like 4 times what we have right now to see more flow through the shelter system. And then I have this 25,000 units of housing that's needed in the region. That is based on a statistic from a statewide number that said we need around 100,000 statewide to address the affordable housing crisis, so that people who have incomes, so that people can afford their rent at every level of their income. We need, that many more housing units. And it doesn't necessarily mean units that are deed restricted with subsidies or deed restricted to have to be people with certain incomes. It just means we need this many units, whether they're naturally affordable in the community, just smaller size units, or whether they're, subsidized or deed restricted units. Again, it's an estimate, but we have a long way to go. And the 25,000 kind of gets closer to that, 35,000 number of people calling 211 to help meet that need. All right, so what's it going to take to end homelessness? I actually believe we can end homelessness. I am definitely an optimist here. And part of that reason is because we live in one of the wealthiest states in the wealthiest countries in the world. If it can happen anywhere in the world, it's here in Connecticut. And what it's going to take is a few things. First is political will. We must have more political will to address this huge gap in housing and program services. And we need the political will to add more affordable housing, add more housing that is affordable throughout the state and across the region. Secondly, we've got to have more integration with healthcare systems. As you saw, the number of people who report mental or behavioral or physical healthcare problems is huge among the homeless population, and we need a much more integrated system. Right now, we have partnerships with our healthcare institutions in the community, but we are not an integrated system the way we really need to be, where we're sharing data and information, abiding by HIPAA laws and everything, but like with, client consent. But there's a long way to go to become a more healthcare and care informed partnership. Next is workforce development and income systems. As I said, homelessness is about affordability. We have partnerships and with workforce development, American Job Center, the Capital Workforce Partners, and a lot of job training, programs in the community. But we have models that are in place to try to help people get benefits and SSI and SSDI. But there is still a lot more support that's needed in that area. Um, and uh, and there's a lot of challenges, a lot of barriers with that come with that specific, both the workforce development and the income support sides. Next is I've mentioned this already, the gap. Got to add housing. We've got to incentivize, improve incentivize construction, improving like zoning, trying to cut red tape for more development. We've got to do more shared housing and communal housing, intergenerational housing, proximity, to family housing, where people can support each other in a better way, in a more cost-effective way. Tiny homes, and when I say tiny homes, I actually mean, complete units with bathrooms and kitchens, like, small studios, micro units, efficiencies. And then we need more rental assistance as well. Um, and then lastly, just more partnerships with the housing authorities and affordable housing agencies and affordable housing entities and units that already do exist. Right now, there are thousands of units of affordable housing out there, but we don't have dedicated priority access for many of those units. It's only a small fraction, and we shouldn't have priority access for all of the units, but we need to increase that number that is available to the shelter system to get people out of the shelters. So our geographic region, our state is divided up into 7 regions for delivery of homeless services. And as I said, Journey Home works in the Greater Hartford that stands for Coordinated Access Network. And we also coordinate the Central CAN, which is just the New Britain, Bristol, Southington, Plainville, Berlin towns. And so Journey Home is a coordinator for each of these 2 regions, but we coordinate, separately across the state. But then Journey Home is also a liaison with all of the other cans, and so we're coming together, monthly, if not more frequently sometimes, to coordinate how we're doing things, how we're operationalizing, learning from each other, best practices. So Journey Home, as I said, we're a nonprofit. Our goals, our mission is to end homelessness, and and really the way we believe that we can do that to the biggest effect is by doing it collectively, by working together with service providers, with social service agencies, elected officials, with businesses, landlords, and municipalities, all working together to advance innovative solutions and achieve systemic change. We don't believe we can do this alone, or that any individual agency or municipality can do this alone. Our goals are to prevent as many people as we can from becoming, losing their housing and end up experiencing homelessness. We're never going to end homelessness if we don't prevent it. And we've got to focus more energy on homeless prevention, or we'll never get to the bottom of this issue. We got to increase the speed at which we're getting people out of the shelters and out of encampments. We've got to Journey Home has a big furniture collection and distribution program, and when people do move into apartments, we provide furnishings and household goods to try to make their apartment feel more like a home and in a positive environment that they can thrive in and have a new chance, have a fresh start, get back on their feet, get back into the workforce if possible, or back into pursuing whatever their life goals are, to be more sustainable and to be more fulfilled. And then lastly, it's just to help them gain and sustain the income and services that they need to never become homeless again. So, mentoring and ongoing support to help them with upward mobility so that they stay as far away from homelessness as they can. So what does a backbone support agency like Journey Home do? We coordinate, we facilitate, we mediate, we do a lot of training, tracking, communications, lots of data analysis, a lot of advocacy, developing policies, collaboratively with our partners, and we spearhead innovation and continuous improvement activities for our system. We also work as a fiduciary and help administer funds, so that if someone wants to provide some dollars to help anyone who's homeless, we'll hold those funds. That way, all of the partner agencies can tap into them. Like, for example, security deposit assistance. We'll have a fund for that way all of the emergency shelters, all of the housing agencies can access that through Journey Home. We do landlord engagement, so we build partnerships with landlords all the time. We have 4 staff that are dedicated to this. And with those partnerships, with those listings that we find, we share those with the network of all of our partner agencies so that the case managers in the shelter can provide those to their clients and say, hey, here's a unit. If you have income, you might be able to afford it. Or to the housing agencies that are providing rental assistance and services, but don't have the units, they're looking for units, they can use those leads to find them. Workforce development, we build partnerships with, like I said, the workforce development partners, like American Job Center, job training programs of all kinds. We share out the information to the CAN, and then we try to get partnerships so that they will receive dedicated referrals from the CAN and from our emergency shelters or street outreach workers to help people get into those job training programs and then into job placement as well. We also are a liaison with the criminal justice system. We work very closely with Community Partners in Action, with Community Court Support Services Division, DOC, with healthcare agencies, hospitals, education. We're like this, when people don't know who to go to in the homeless service system, they'll come to Journey Home and we'll try to help triage whatever it is. Let's see, I already mentioned that. Cold weather planning. So Journey Home is really responsible for all of the protocols that are put into place in the winter. So working with all those warming centers that I mentioned, when the governor declares a severe cold weather activation, we are making sure that it's very clear to all of the partners, providers, where people should be going, and then how to make sure that people are getting accommodated and not turned away during those severe cold weather activations. Now, throughout the winter, if it's not a severe cold weather activation, the people are regularly turned away, unfortunately, from if all of the warming centers, all of the shelters are full, then people are turned away. But if it's a severe cold weather activation, then we work with 211 to transport, hotel people, set up food services. We're like working around the clock sometimes in those scenarios to try to make sure people don't fall between the cracks. We are also, disaster response planning. So the pandemic, we were the lead agency for our region with all of the pandemic response, evacuating shelters, setting up the testing and then vaccinations and all of that work. We do the same when it's a hurricane. All of a sudden we have an influx of hurricane victims or any other kind of disasters. We're a collection and distribution agency for emergency supplies during these crises, as well as I mentioned before, the furniture, household goods that we have volunteers primarily running 5 or 6 days a week, collecting donations of furniture, and we have a couple box trucks and a warehouse, and delivering the furniture to people who were homeless and are moving into apartments. We have a wait list for that program, about 50 people long, who have already gotten their apartments and are still waiting on deliveries, because we need more volunteers and donations for that program. We also do all of the street outreach coordination. So all of the people that go out into the parks and engage people in encampments and tents, we are coordinating all of that and tracking all that data and information through our platform that we have, and trying to maintain all of the data and keep it updated, which is almost impossible because the population is so volatile. It's just changing like every single day. We also do housing search for domestic violence victims in the region in partnership with Interval House and with the network, and help them find leads on apartments for their clients. We coordinate youth and young adults, homeless programming, which is specialized programming for that population in the region. We've been moving increasingly into homeless prevention coordination, working with various partner agencies and aligning new resources to be able to do more homeless prevention, which is very exciting. And then we partner with municipalities as well, like when they have encampments pop up, those kinds of things. We'll work with municipalities to address those issues. I'm gonna quickly just go to the bottom of this slide. An estimate, this is not perfect, but an estimate of how much we would need of program assistance to help address this crisis would be 74 million additional dollars to what we have in Greater Hartford, which is, you know, it's not astronomical. It's not even that much for a state that is wealthy as our state. That's nothing. So I'll leave it there. Benefits to the community of filling this gap. I'm almost done here. Prevention of long-term issues. All of the things that come with homelessness. People will often say, well, people are the substance use came first, and that's why they become homeless. And that's true for some people, but a lot of times people fall in hard times, they end up experiencing homelessness, and then the substance use comes and the mental illness comes, as you can imagine. Breaking the cycle of generational poverty and homelessness. We don't want people to spiral down, and we don't want children of people who experience homelessness to then experience homelessness again. And you're more likely, statistically, to experience homelessness if your parent experienced homelessness. Um, Cost efficient, it's 3 times more expensive to serve somebody who's experiencing homelessness than to prevent them from becoming homeless in the first place. And that's just the expense of our homeless services system. That does not include all the legal and justice and healthcare and cost to the community that homelessness has. So it's massive cost, and makes no sense for us to have to allow homelessness in this state. And then lastly, it frees up our emergency departments. When there is no place to go, like in this winter, when we turn people away, they go to the emergency departments and they will stay there. And then when other people who have an emergency, and need to see someone, now the emergency room's full. So this hurts our entire community. And so this is another benefit of filling these gaps. Looking ahead, some of the things we're going to be working on in the coming couple of years. We want to grow the number of constituents, members of the community who are willing to advocate and stand up for positive change, to contact their legislators, to attend their local zoning meetings, to agree to fight for housing. And Another thing is, just like I said, expanding homeless prevention using equity-informed strategies. And when I say that, I know that DEI is wildly unpopular at the federal level right now, but you're 9 times more likely to experience homelessness if you're African American than if you're white in Greater Hartford. And you're 6 times more likely to experience homelessness if you're Hispanic or Latino than if you're white. And so when I say equity-informed strategies, I just mean culturally responsive programming that can better serve these populations than we have been serving them. Third, continuing partnerships with municipalities, with housing authorities, landlords, and working to house more people directly from unsheltered locations, where they are sometimes feel trapped, or that there's not enough space in the shelters, or they're refusing shelter for various reasons. Now, most people don't refuse shelter, but there are a lot of people who will not go to shelter if it's offered to them. And so we just want to get them right into housing. We can skip the shelter, just get them into housing. And then lastly, just adding more housing, as I mentioned many times already. Ways for you all to connect with us if you want to get involved. Like I said, advocacy is a huge part of what we do. We have an advocacy listserv. We would love for you to be added to that. If you could send Rachel or myself an email requesting to be added to that list, we will get you connected. We're developing this area of our work, so you might not get a lot of emails, but we are trying to do our best to improve and get the word out when there are public hearings and when there are zoning meetings regarding housing and local communities. That's our plan, at least for the next couple of years. And the second way is, as I mentioned, our furniture collection distribution program. If you want to volunteer to help move furniture to somebody's apartment that has been homeless, we need volunteers. We work with all kinds of community organizations, groups, Girl Scout troops, schools, just families, individuals, like if you want to drive a truck, you can, get trained on how we do that. And then if you want to donate, gently used furniture, there is a very specific list of things we do not accept, unfortunately, because it's all volunteers. We don't accept like huge sectional couches or like marble top, heavy items. And remember, most people moving into apartments are moving into um, very small one bedroom apartments that don't have a lot of space for like entertainment systems or like big, huge dining room tables. So please be patient with us if we're like, I'm so sorry we can't take that item. But if you have something else, let us know. And also we have drop-in hours, which is our favorite way for you to donate. 2 days or a couple of hours, our warehouse is open and anybody can just come and drop off their items. So you don't have to wait on a volunteer to come and pick up the items from you. Um, Questions and answers. Again, here's my contact information. If anybody has questions, if you want to connect in any way, I would love the opportunity to hear more, get to know you more. And I will turn it back to Rachel to facilitate questions and answers if you'd like.
Thank you so much, Matt. I mean, I know this is, such second nature to you at this point, but it's definitely a lot of information. So I'm thinking people are going to keep processing, what they just heard as we kind of think through all this. So first, I'm going to go through some questions and then maybe we can tease out some other things if people wanted any more explanation or clarification. So one question is, do you know the percentage approximately of Connecticut unhoused people who are long-term versus facing emergency circumstances?
Long-term what? Long-term homeless?
Yes,
Or
versus an
unhoused?
emergency situation.
Yeah. Um, uh, I'm just thinking I had a slide and I was thinking about sharing it, but now I'm not sure where it is. Um, uh, that statistic.
Well, more just, generally
Yeah.
speaking. Yeah.
So, I would say that, about a third of the people who end up losing their housing and becoming literally homeless are in and out of the system with no assistance within 3 or 4 weeks. They're, like I mean, some people are there one day. Like about a third of the people are just really quick in, they're like, I'm not getting the help I need. I got to get out. I've got to figure something out. Even if they leave to um, a a, a, a precarious situation, a temporary living situation, they're in and out of the homeless system very quickly. Now, that doesn't mean they won't come back again. They are still very likely, to come back again, especially if they're going to another temporary place where they're staying for a week or two. Maybe they have a little bit of income. The first of the month comes, they can afford to pay somebody to sleep on their couch for a couple weeks. And then I would say another third is in there for, like 6 to 9 months, and then maybe a third is there for, longer than a year, unfortunately.
The next question goes back to that wait list of people who they've gotten the housing, but they're waiting for the furniture and the goods. Is
Oh,
that
yeah.
just based on the need for volunteers in furniture, or was there one more specific thing that people could do to help close that gap?
I mean, donate dollars would be a huge help so that we would have more capacity and that we wouldn't have to be so reliant on volunteers. But definitely need more volunteers to fill the calendar for being able to make those pickups and deliveries. And then we're always looking for different types of donations. We do have a special listserv that is just specific to that program, that where we're like, some weeks we're like, we have no pots or pans. We're out of pillows this week. Can anyone donate pillows? So like we're out of, we have no coffee makers or microwaves, and we would love to provide those to people, in their apartments. Um, and so that's always something, that we're looking for. But yeah, it's more just like we need to churn through more at a quicker pace, and that requires more volunteers.
The next question is, can you give a short overview of homelessness by age range? Um, and then maybe we may have some related questions to
Okay.
that.
Um, yes. So, I mean, I have data on this I can get to you at a later time, but I would say that over half of the homeless population is is in their is 50 or older. And so we do see um, a lot more people in the older demographic, um, and and including the elderly population. We do have elderly people who are experiencing homelessness, even though there's, elderly housing programs dedicated to the elderly population. We still have a significant number of elderly in our homeless system. Um, I can try to get that to you, like a better breakout by age range and everything. I do have that somewhere.
Thank you. How about veterans? Has that increased or decreased with veterans being housed over the past few years?
I'm so glad somebody asked this question because I should have included this in my presentation. Nationally, and locally, the one population that we have seen decreases in homelessness has been veterans. And at the national level, part of the reason is we've seen much more investment into programming, rental assistance and services for the homeless veteran population. And national. And while homelessness has been on the rise for the last 2 years, by like, or 2 or 3 years, by like 13% each year, veteran homelessness we have actually seen go down nationally and in the states, thankfully. And that just to me, that proves, it demonstrates what is possible when there is investment in a system, appropriate investment at the level that's needed to be able to actually see flow, through that system, and even to prevent homelessness. Most veterans that are facing homelessness are getting prevented from actually entering our system because there is a lot of programming and resources available to them. We need to expand that to the rest of the homeless population.
Thank you. So we heard a lot during COVID about hotels being used to house people. We get a lot of comments in the office building that our library is temporarily in right now, saying, comments on all the extra space where you have office buildings where people do not have to report anymore as much as they used to. Has that continued after COVID where those spaces are able to be used?
So during COVID, there was I mentioned it briefly, there was, a huge kind of evacuation process from shelters where everybody was in these congregate settings, and, COVID could spread very easily. So we moved everyone into hotels. And once we were able to get vaccinations, once those became available, we moved people back into shelters. However, one of the large emergency shelters in Hartford was a huge kind of dorm style place. They actually, with pandemic relief dollars, acquired a hotel and have moved their operations from that large dorm style building into this hotel. And so they're permanently now located in the hotel, which is amazing because now we have this different style of a shelter where there's only one or two people in each room, each bedroom, and can work really well for special populations, medically compromised, or people that just need additional supports and services in a different context than a large dorm. We have that as an option now in our community, which is amazing.
Are there any types of programs where some people actually might be able to be employed to then go back and help Journey Home and there are other organizations like that?
Yeah, actually, so I mentioned Journey Home has a career pathways programs, and we've actually employed, we have an employee now, who was living in an emergency shelter and now works on our furniture program. He's our like warehouse operational manager person, and has been with us for I think about a year now, and been phenomenal. Just been awesome, and yes, so. We also have our other partner agencies are really intentional about trying to make sure that there are peers who work at those agency, people who have experienced homelessness themselves, to be able to better connect with the clients they're trying to serve and help them feel more comfortable talking with them and being able to say, like, look, I've been there, I've been in your shoes. Here's what you need to do, to get yourself into a more housing stable situation.
Listening to how successful programs have been for veterans, is there another particular group where there is potential political will to support?
There's always a lot more compassion for families with children, um, I would say, and even homeless youth, young adults. There seems to be, I mean, there is already some specialized programming, as I mentioned, for young adults, like ages 18 to 24. Um, but homeless families and children, I would say, would be in not nearly as many of those as there are just individual adults. But that would be, I would say, a group that would be an easier sell to get support around, to eradicate, family homelessness.
And can you just give people some advice about the community organizing that you mentioned? What would be like a few first
Yeah.
steps to take to start that?
Sure. Like I said, email me, and we can get you on our list serve. One of the things that we are hoping to do is partner with the Greater Hartford Interfaith Action Alliance and the Center for Leadership and Justice. And they have an initiative that they've launched this year called a HAT initiative, which is Housing Action Teams, where they're trying to organize people from local communities to go to their local zoning meetings when they come up, and when there's often people that are adamantly against any kind of development at all, and particularly any kind of housing. Especially if the word affordable is even mentioned, but in general, if there's any kind of housing, there's often resistance to it, and there's all kinds of things that will come up in those meetings. But so just having people, there will be trainings for this, for anybody who wants to join in these efforts. And we'll be hopefully, able to, get some people to these local meetings and have some voices there in support of adding housing to the region. As I said, the number one problem is the rental prices, and by adding more housing, we can help those rental prices fall, hopefully, when there's, uh, when landlords don't have the pick of 1,000 people to choose from for that are applying for those units, then they will begin to lower prices. And so hopefully, if we can add thousands more units, then we'll be able to see that.
Do you happen to know of any plans right now locally for any other units to be built?
Um, I we have started tracking all of the local zoning meetings. We're still gathering some of that information. Every municipality has a affordable housing plan, and we do have a spreadsheet with all of those links. And there are some municipalities that have listservs for their zoning boards, and so we've been signing up for those that do have that option. I do know of one development that's going to be happening in West Hartford, right on Highland Street. And it's not deed restricted, but it's a vessel is the name of the it's a private company that's developing it. But their model is to develop housing that is naturally affordable in the community, meaning it's smaller sized units. They're not like luxury units with all kinds of amenities. They're just, basic small apartments. And so that is a project. I believe there's at the beginning of February, there's going to be a zoning meeting. So if anybody's from West Hartford, definitely let me know.
Is there a state or a program that you look to for best practices?
Um, well, Connecticut is actually been named as a leading state in the country when it comes to ending homelessness. We do attend our national conferences. The National Alliance to End Homelessness is a nonprofit at the national level that has a conference, many conferences every year, and we attend those to learn what is going on, best practices in other states and other parts of the country. So there's various endeavors that have been happening in various communities across the country that I can't name off the top of my head. I know Austin, Texas has some good work that's been going on, and I think California has, Ohio, Columbus area has, Hennepin County, um, uh, Arizona, Virginia. Virginia has actually done a lot of great work on veterans. Um, but uh, but I would have to check for details on all these things.
How difficult is it to get landlords to agree to accept clients with rental assistance benefits?
So Journey Home has what we call landlord partnerships that we develop, or um, we basically have a risk mitigation program for landlords that if they wouldn't normally take a chance on somebody that might not have the best credit or best income history or might have a criminal history, if they agree to rent to someone who has been experiencing homelessness, then they can we provide like kind of like an insurance policy above their current insurance, or like if for some reason that client causes damages to the apartment, or abandons the unit or doesn't pay rent or whatever, they can file a claim with us up to like $1,000 and get reimbursed. So that's like one thing we try to provide to landlords. And then the other thing that we're always looking, trying to fundraise for is incentives to landlords. So a bonus payment right up front, like often equivalent to whatever the monthly rent is, which is, just an additional, lowering their risk a little bit. If they're willing to rent to one of our clients, then we'll provide that like incentive payment, bonus payment right up front. So we have been pretty successful at finding landlords. Using those programs. And then just there's so many people out there. So word of mouth, trying to be very responsive to landlords whenever they do have an issue or a problem or question, or like a lot of the clients that move into apartments have a case manager, but the case managers are often changing at our partner agencies. They don't get paid very well. And so sometimes landlords will call us and be like, hey, I'm not getting a response from this case manager. We'll follow up with that agency, say, hey, this person's not responding. And we might learn that, oh, that person is no longer there. There's a new case manager, and provide that information to the landlord just to, because they want somebody to call if anything is coming up, any issues. But we've been, fortunately, pretty successful at recruiting landlords.
Does anyone else have any questions for Matt? Is it difficult to find a landlord who will rent to a person with mental health issues?
Like I said, we've been able to find most of the people that we've been able to house have mental health, and so uh, we often will market to the landlord when by saying they have a case manager for somebody to call if there's any issues that come up. And so that's a help to the landlord. And it's not perfect. People still, there are still problems that come up that we can't resolve, and people still do get evicted from, so even from some of our landlord partners, and but fortunately, the vast majority of the time there's no problems. And the reality is people that experience homelessness, the people that have not experienced homelessness can have any number of the exact same issues, behavioral health, mental health, and lease violations as people who were experiencing homelessness. So, um, so, so there is that.
Oh, excellent. We'll
Oh,
connect you.
nice.
Yeah, you saw that? So
Yeah.
we'll connect you with the Greater Hartford Interfaith Action Alliance to maybe do a presentation for them as well. And yes, if any of you are, members of another community or organization that needs this information, it will be recorded so you can share it with your group. Um, we had a request for the slides. They will be on the recording. So you'll be able to see them that way.
And I'm happy to email them to you too, Rachel, if you'd
Oh,
like.
that's great. Okay, so that's even better. So that people can share this information. Matt, thank you so much for taking the time to be with us tonight. Thank you for the work that you're doing, you and your organization. And I think we really heard a lot of ways that people can get involved. But if anybody, has any other specific questions, I'll send Matt's email along to everyone and information of how to get on the listserv.
Thank you. It's an absolute pleasure to be able to have this kind of an opportunity in this forum to engage with other people that care about this issue. So thank you so much.
Thank you so much. Everyone says thank you. So have a good evening, everybody.
Have a good night.
And we'll definitely be in touch.